Good evening. I'm Victor Sande. I'm a counselor psychologist by profession, and I'm a Billings Ovulation Method teacher. Today in this my YouTube channel, I'm pleased to introduce you to Billings Ovulation Method, a type of natural family planning that I want to make you be aware of its existence, and this particular method, it's real and its effectiveness is 99% effective. When you're talking about billing as a type of natural family planning, I know a question might come into your mind. How many or other types of natural family planning do we have? Remember, we have different types of natural family planning. The ancient one that has been used for so long, and later on people abandon it. Majority of people abandon it because of its lower effectiveness rate, that is the calendar method or the counting of days, which many people, especially many women, are very familiar with this particular type of NFP. But today, that is not what actually we are going to tackle. With counting or calendar method, its effectiveness is around 77%. And why this one is not part of the Billings Ovulation method is because NFP calendar method, it has its own weakness, and its weakness overrides its effectiveness. That is, calendar method has been known to have a failure rate, and factors that contribute for its failure rate are: with calendar method, a woman who has no regular cycle cannot be able to use it. That is short cycle. Also, ovulation can be affected by stress, physical strenuous exercise, sickness, lactation, etc. We found even for those with regular cycle, this method is not that effectiveness, because remember, your reproductive system ages as you age, and once it continues to ages, it also shows different characteristics depending on the phase, on the age at which you are. That means, by the factors that I've just mentioned, if they chip in, they might delay your ovulation. And here you have been using counting of days, that is fixed number of days, knowingly at this particular moment I will ovulate. But with those factors, it might push the ovulation further, affecting the number of days that you're counting, thus tending to get pregnant where maybe you have not yet planned. Now, it is not also withdrawal. We understand that sexuality or sex is supposed to be enjoyable between a husband and a wife. What happens during withdrawal? It introduces an element of selfishness, because it's only one party that will enjoy, or even both of them, they might not enjoy to the fullest. Why? Because of fear. What about if that little semen penetrate and cause pregnancy? What will happen? Now, for them, actually, when they are in that act, their concentration will not be on the act. Their concentration most of the time will find that they will always on the defensive side not to get pregnant. And the way sometimes nowadays we fear pregnancy more than diseases, and yet is something noble. That is the only way that we humans come into the world. Now, having at least touched those two types that many people have been thinking that they are part of natural family planning, although they are, but its effectiveness is low. Now, the best NFP type that is known worldwide today, that is its effectiveness is 99%, is the Billings ovulation method. This was a breakthrough for the women. This particular method is a knowledge that every woman needs to have. Let's see through the PowerPoint what it is. I'll be able to share. I'll be able to share with you to see what it is. Now, I hope you are prepared for this particular topic for today. And if you have any question, kindly, you can just write your question. At the end, I will go through them and see the ones that I can be able to answer. But feel free to interact in this particular session. I want to share my screen with you so that you can be able to follow it. Understand I might talk some biological terms, but do not worry. Now, the Billings ovulation method. Billings ovulation method, it helps a woman in identifying the infertile and the fertile phases of her menstruation cycle. We will see how it is possible for a woman to be able to recognize these phases. It's not a magic. It's as simple as taking water. But as long as you have commitment, willingness to learn, when you're motivated psychologically, your behavior will reflect the goal that you want to achieve. And if you're a couple here, welcome. And if you are a woman that you want to know how your body operates so that you can be able to monitor your reproductive system, welcome. Now, before that, I feel it is also wise and justice for you to be able to know when I'll be talking about some terms, you can be able to visualize what I'm talking about. And here I'm going to show you, to give you a presentation about the woman reproductive system in conjunction with how it operates with the BOM. And here is a PowerPoint, it's a video that kindly just go through it, just listen, and you see how it is. Sorry for that. Now, sorry for that mix-up. I think the video, maybe I will be able to post it in the YouTube later on for you to see it. I think there's a mix-up here. Now, Billings ovulation method is a natural way either to achieve or postpone pregnancy. And the added advantage, another added and very important function, is the monitoring of reproductive health. We understand today many women are flocking to the gynecological clinics. If you go to the hospital today during gynecological clinics, you'll find many women queuing. And most of them, they have issue regarding fertility. And with this particular knowledge of BOM, it empowers women to know when they are fertile or not fertile. And in this particular period, particular method, it can assist them to know whether they are ovulating or not. Remember, if you don't ovulate, there is no way that you can get pregnancy. And sometimes ovulation might occur without a woman be able to notice. And what happens if a woman does not be able to notice? You find some people have been termed as barren, yet they were not barren. They only needed this knowledge to be able to understand and recognize where ovulation occurs. Remember, even ovulation can occur during or after menses. And you find that because of our African taboo, having sex during period, it was a taboo. And you find maybe it was during these particular moments that this woman had the fertile phase, the fertile mucus. And we'll see the importance of mucus in the achievement of pregnancy. Now, the next one is about postponement of pregnancy. And this one, the second function, this is where majority of people, they have despair when it comes to how they plan their family, because they say this method does not work. This method has failure rate. Some you have heard from your neighbors, from your friends, but in reality, let us do justice to this particular method. When they say this method does not work, they have used NFP. Do you take your time to probe them more to find out the kind of NFP that they were using? For me, I took some research regarding the clients who are assuming that this particular method did not work. I asked them, yes, you have been using. What kind of NFP were you using? You find majority will tell you we are using the calendar method. Some, they will even go to the extent of telling you this method, I was using the withdrawal. Then I told them automatically that the chances of you getting pregnant was high because of this and these factors that I've just mentioned them. But with the NFP, with the Billings ovulation method, it is 99% effectiveness as long as there is a discipline, commitment, and following up of the guidelines that guide this particular method. We have 4 rules that once you become familiar with them and you apply them, then you are good to go. This method will work for you. The third one is the monitoring of the reproductive health. Today, we understand we have many gynecological issues: ovarian cancer, breast cancer, cervical cancer. Now, the good news about the Billings ovulation method, a woman who uses this particular method, she's capable of detecting at an early stage if there's any abnormality in her reproductive system, because the pattern that will emerge from how she from the pattern that she has been charting, her chart will be able to reveal any abnormal pattern in her chart. And through that, action can be taken at an early stage. We understand the earlier the detection of diseases, the higher chances of treatment and healing. But once maybe it is stage 4, what happens? It becomes difficult. Now, with this knowledge of the Billings ovulation method, it empowers women to know their bodies, how they operate. And in fact, this particular knowledge, it's supposed to be one of the rights. As we say, we need to empower women. This is part of you. This is part of empowerment that you need to have. Now, this particular method also, it is very easy to learn. It is very easy to learn, simple to use, and it doesn't use any device or drugs. It has no side effects. You know, sometimes when you use contraceptives, your worries, maybe migraine, we have those side effects that women normally experience, but this one is naturally because it uses the natural signs of fertility. There is no addition that will add or subtract from your body. You have just to be there to experience, to make observation, and to experience yourself, how your body operates. And we will see how you will be taught, a woman will be taught on how to observe through physical and through the sensation. This particular method, it is reliable. It is reliable once the rules have been adhered strictly. Failure to adhere, it becomes unreliable. That's why I say it's also a couple responsibility. It is not one-sided party. If you couples who wish to follow this method, to use this method, then they have to cooperate as a team. Without cooperation, this method will not work. Then the other added advantage also is morally acceptable to all cultures. People of any race, of any tradition, of any culture, they can use it comfortable because there is nothing that will add or subtract. It is naturally. Everything that you have is what you experience in your body. And this is the noble about this particular method. You see, every religion accepts this. This one is the method that it has no debate. The only part of the debate when it comes is, hey, what about if I get pregnant? What about, that is the worry that majority people who at the beginning who want to use this particular method, they will have those issues. But with time, they will see, because whatever here I'm teaching, the Billings Ovulation method is science, pure science. Now, also when we talk about fertility, remember, fertility, it's combination. Male fertility and female fertility is equal to couple fertility. In male fertility, where does the fertility begin? Sperm productions begin at puberty to the production of sperms, which continue throughout the life. That means a man is fertile, potential fertile throughout. But for a woman, her fertility begins from puberty and is cyclic. It's cyclic. It keeps on repeating every other cycles. Every other cycle. And in this cycle, you are being told a woman is potential fertile only around 5 to 8 days. And her fertility diminishes at menopause, unlike man, who is fertile throughout his life. But for a woman, it diminishes at menopause. Menopause, I mean, that is the end whereby the eggs are dead. The woman can no longer be able to release egg. The eggs are dead. And everything is dead in terms of the reproductive life of the uterus to carry pregnancy has come to an end. Now, when you combine male fertility plus female fertility is equal to couple fertility. And that's why I say it is a collective responsibility between a man and a woman. Now, both men and women from the onset of puberty have the potential to be fertile. Both are at the peak of their fertility in their 20s. Hapo ndio the body now burns. The body burns. Hapo ndio na you feel hyper now and then. The eggs are being produced at large number. The eggs are being produced at a higher rate. We have good quality sperms, good quality ovums. Hmm? By the time a woman has entered menopause, her fertility is over. Whereas the man has the potential to become a father into old age. But this one does not mean men, you have to wait until you are 60, 70. Where that's the time that you want to marry because you have been told you are fertile throughout. But this is like giving you a warning that for you, you are always fertile throughout. You need to take care. A woman is only fertile for a short number of days in her cycle. She will ovulate on only one cycle. She will ovulate on only one day within each cycle. Remember, that whole cycle that you are talking, when I'm talking about cycle, is from the beginning of the first day that she bleeds until the end of the end where the other bleeding starts. That is that whole cycle. We have women with short and long cycles, some 21, 27, 35. With that, remember, within this particular period of that cycle, we are being told a woman only ovulate once. And it is during this period that a woman can get pregnant. And you wonder, then why should maybe a woman take contraceptives for the whole period of this, yet it is one. And this is not the possibility of what anyone who wants to use it a particular method called uh, Billings ovulation method. It will assist you to be able to recognize this phase, that is ovulation, and we normally referred as peak. Peak is the day of highest fertility and is the day of slippery. Now, she will ovulate on only one day within each cycle. If the egg, which is released at ovulation, is not fertilized, it can only live for a maximum of 24 hours. Can you imagine? That egg, if it's released, it can only live for 24 hours. Let's take an example of 28 days. Out of 28 days, this egg can only be released once. And once it is released, it can only live for 24 hours. Can you imagine that? Now, with the Billings ovulation method, it equips you with the knowledge to be able to recognize this particular day when the egg will be released. And it is very simple as long as you commit yourself and you follow the guidelines, then eventually you will be able to recognize this particular day. Kindly take this, mark this 24 hours that the ovum can be able to survive for 24 hours. And we said previously that a woman is potential fertile for 5 to around 5 to 8 days. And the egg can be released. It only released once and it can survive for only 24 hours. And yet the woman is fertile for 5 to 8 days. Can you imagine that connection? Can you imagine that connection? We will see that connection, how it is connected, the lifespan of 24 hours and the potential fertile for 5 to 8 days. We will see. The man is very different as he is producing sperm each day, but it is only when the woman is fertile that sperm can survive and fertilize an ovum. The man is very different as he is producing sperm each day, but it is only when the sperm is fertile that sperm can survive and fertilize an ovum. Now, if you have been keen, this statement here, it answers the question, it answers the challenge that I've given you. If ovum can be released once and can survive for around 12 to 24 hours, and a woman is potential for only 5 to 8 days. And here we're being told a man's sperm can be able, when the woman is fertile, that sperm can survive and fertilize an ovum. Then we ask ourselves, what is the lifespan then of sperms? How long can sperm be able to survive? Whenever I've been asking this question, people have been saying sperm can be able to survive for a long time. Some say 3 to 5 days, and some they imagine even after having sex in the evening, the following day the sperm will still be alive. But let me now put it clear. Sperm can be able to survive in fertile phase, that is under the fertile mucus, for 3 to 5 days. But sperm cannot be able to survive in unfertile mucus for a long time. It will die within a short period of time. In fact, we normally don't even give the time because that duration is very short. Now, what is the characteristics of this fertile phase, the fertile mucus that is being found under the fertile phase? One, this mucus, I've been talking about mucus, maybe some people might wonder, what is this fertile mucus that I'm talking, the mucus that I'm talking about? Every woman, nearly every woman, because it's ideal every woman to be producing mucus. Some might, maybe they have not been noticing this mucus coming from the vagina because of the quantity that might be produced is very minimal for them to be able to detect. But actually, without mucus, without this mucus, you can't get pregnant. Now, apart from bleeding, blood that a woman normally sees that comes from the vagina, what other experience have you as a woman experienced something emanating from the vagina? For those who have been keen, we have been seeing some kind of mucus. That is like if you have a running nose, you normally produce you, you normally produce your mucus. You produce them. Now, from the vagina also, mucus might come from there, depending on the phases that you are in. And some, they describe them in different ways, some cream, some white, but to not generalize, because we normally say every woman is different and every woman needs to describe on her own words. And that's why even this method can be taught even to an illiterate person. This knowledge is for anybody, despite the level of education one is in. Now, this fertile mucus, it has some characteristics that makes this sperm to be able to survive for 3 to 5 days. Number one, it feeds or it provides sperms. It provides sperms for food in order to survive. Remember, we said a woman is potential fertile between 3 to 5 days. Now, a woman might start producing the fertile mucus, and this fertile mucus normally it keeps on progressing until it reaches a point we normally refer to as peak. We normally refer it as peak. Now, if the woman has started producing mucus and maybe she will eventually ovulate in the next 3 or 5 days, and today the couple had the intercourse, that means the deposit of those sperms, they will be there, but they will continue to be nourished by the mucus, waiting for ovulation to occur. Once ovulation has occurred, and the sperms that have been deposited in the vagina, they normally stay in the cervix. There's some crypts in the cervix that they stay there waiting for ovulation. They will be released. Now it takes us to second characteristics, which is it provide transportation or road network for sperm to be able to travel to the fallopian tube. It is like it provides a road network. It provides, and even there's one professor known as Professor Odebladi, who through laboratory eventually gave the evidence of the pattern of the mucus depending on different phases, how they contribute to either uh, to either death or survival of sperms. Now, the third one is remember a man. How many sperms does a man produce every ejaculation? Millions. You ask yourself, among these millions of sperms that are being produced in every ejaculation, and a woman only release egg, either one or two, depending, two maybe if they are twins. And here we have more than millions sperms being produced. Where does the rest go? And remember, even those millions, they are not all of high quality. Now it gives us the third one, which is it locks abnormal sperms from getting access to the fallopian tube. It is like it acts as a filter, protecting these abnormal sperms from entering into the fallopian tube and fertilize an egg. Thus, it reduces the chances of having abnormal children. Now, the one with infertile characteristics, infertile mucus, it is the opposite of the fertile mucus. For the infertile characteristics, it creates acidity environment whereby sperms cannot be able to survive. That is unconducive environment where sperms cannot live for long. It eventually die. I hope we are together in that explanation. And now you find that I've mentioned those 5 to 8 days and how sperm can be able to survive for long. Now we need to ask ourselves regarding the BOM, because the center of the BOM is about ovulation. That's why it is referred as Billings ovulation method. Ovulation. Once a woman ovulates, automatic. This is automatic and this is science. She will get her next menses in the next 11 to 16 days. Below 11 days, when she bleeds or she gets menses, below 11 days, that's the whole cycles become infertile. But above 16 days, if it goes beyond 16 days, that means pregnancy has occurred. Now, you know and now understand why ovulation. It's to recognize when ovulation has occurred. Remember, ovulation is a sign of good health for every woman. And that's why we are saying this method, it assists women in monitoring their reproductive health. Failure to ovulate is not a good sign. You will need to see a gynecologist if the pattern is not explainable, because we have seen there are several factors that can affect or can delay ovulation, such as lactation, stress, strenuous physical exercise, changing of weather, etc. They can affect. But once you work with a teacher, once you've become familiarized yourself with the BOM, you can be able to detect and to pinpoint exactly what is the problem. And with this chart, even you can take it to a gynae who understand BOM and diagnosis. Instead, the gynae can be able to make differential diagnosis rather than going there blindly without knowing what is happening to you. And that's why you find when you go, it's only provisional diagnosis that will be made. But by having already this chart with yourself already in terms of diagnosis, you are good to go. Your diagnosis will be made easily without any difficulties. And that's why it's a knowledge for every woman that needs to have. Now, the Billings ovulation method teaches you to recognize when in the cycle you are infertile, as well as when you are fertile. This information can be used to either avoid or achieve pregnancy. Look at how that couple, how they smile, knowing that they are the boss of their life, of their health. They don't have stress, fear of side effects. They have planned themselves. By the way, this particular method, it's real, it works. Being a teacher, I'm also a user of it, and I've been blessed with 4 children. And all along, we have been using BOM. Next session, maybe I'll give you the experience that how we went through it. Although at first it seems difficult, but through patience and guidance and commitment and cooperation, it becomes easier and enjoyable. And we will see other benefits even for the couple, for the individual woman, whom she will be in control of her own reproductive health. By knowing the phases of the cycle, you are in control. Remember, God made whatever God made. When God created us, He said, it is good and it is perfect. We are wonderfully made. It's only we do not have time. We are so much worried about external issues, factors, forgetting our own self. Today, we do not know ourselves. We are like robots. We just things that are convenience. We do not want to take time to understand ourselves. Let us take this as a challenge. You man who are watching, you woman who are watching, just try. Now, for you to be able also, I feel it was justice for me also to take you through the female reproductive system. I understand some of us, we dropped biology when you are ready in Form 1, and yet you are supposed to drop it at Form 2. When you hear biology, these are terms sometimes they chased you from class. Already your brain, your mind was fixed. I can't understand, I don't want to stress myself. But you wonder today, this teacher has taken us back to biology. But sometimes their reality in life, sometimes you cannot run away from them because this organ, it's in you or is within the person that you live with. Sometimes it's just good to get the basic. And that's why I find it fair for me to introduce the female reproductive system so that you can be able to understand whatever there are sometimes that terms that I'll use, you become familiarized yourself with. Now, this is the female reproductive system. It is made up of fallopian tubes. Let me use the pointer for you to be able to see. Laser. Yes. This is the fallopian tube. This is the pathway whereby once the egg is released from this area is called the ovary. Ovary is like a factory that produces eggs. It produces eggs. Here is where eggs are being manufactured, and once they mature, they will be released. The release of the egg is what we term as ovulation. The release of the egg is what we refer to as ovulation. And here, when they are being manufactured, these eggs, at analysis, at each stage, they produce something we call hormones. And these hormones, they are very important in production of mucus and also in helping in building something we call endometrium here. This is the wall that we refer to as endometrium. In simple terms, I normally refer to it as the bed of the baby, where the baby will attach itself here once fertilization has occurred. Now, ovary is where the eggs are being produced, and also once the eggs are being produced, they emanate or they cause estrogen to be produced. And once they are being produced, they will have an effect here at the cervix. Cervix is where mucus, whenever you hear me talking about mucus, this is the site where they are being produced. And remember, they are being produced under the influence of hormones. And these hormones are estrogen, progesterone. They are called ovarian hormones. Here in this cervix is the neck of the uterus. It is the door, the entrance towards the uterus. This place, this site, it ensures nothing enters here before the time that is supposed to enter. The sperm cannot be able to penetrate until the right time, during ovulation and during menses. When the bleeding here, this wall collapses and it comes in form of bleeding, and we normally refer to as menstruation. And remember, when I'm mentioning even menstruation, I like you to be able to be keen. When I'm saying menstruation, remember, not every bleeding that you experience, that is menstruation. No. We have four different types of bleeding. We have menstruation, which it is supposed to have been accompanied by peak or ovulation. Second, we have withdrawal bleeding, that is the withdrawal of hormones that support the endometrium. Third, we have breakthrough bleeding, a sign of high fertility. This bleeding you might see, and ukasema hii damu si ya kawaida, the bleeding is not normal, but it is because of high fertility. The hormones are high. Then we have implantation bleeding that occurs around 7 to 8 to 10 days after fertilization has occurred. Now, with the BOM, it will be able to pinpoint to you if these bleeding are falling under those categories of normal bleeding. Failure or outside of that bleeding is pathologic. It needs to be investigated and to find out. Remember, bleeding also can be a sign of disease. But once you chart, you can be able to tell and to differentiate the kind of bleeding that you have with consultation from your teacher, even with a gynae. Now, we have the endometrium. This is the bed where the baby attaches itself. Then we have this hollow. This is the vagina, where also some discharge might be produced under the influence of hormones which are being produced here. Then we have pocket of Shaw. I don't know if you have been keen as a woman during menses, when blood emanates from the vagina. What happens? Sometimes you might experience dry feeling or a kind of discharge that does not change day after day. Then you start experiencing types of mucus that keeps on changing and progressing. Like, for example, after a period, you had dryness, you had a discharge that does not change after day. Then all of a sudden, you see there's another change, a different change, and it keeps on changing. Then all of a sudden, you feel dry and nothing at all. Now, the dryness that you feel at that particular moment is because of this area called pocket of shore. This area, it absorbs all the moistures, and it is one of the indicator to tell you that peak has occurred. And we will talk more about peak in our next session. These are the areas now that you need to know them. Then we have the vulva. The vulva, that is the mouth of the vagina. This is where a woman needs now to pay attention, because like every bleeding that comes, how does a woman notice bleeding is coming? It's because of this area called pocket of shore. This area it's very sensitive, and it is believed to be 5 times sensitive than the tip of a fingertip. Can you imagine this your fingertip? When you touch it, how do you feel? Already you feel there is sensation that you feel. But can you imagine you are being told the vulva is 5 times sensitive more than this fingertip? How sensitive it is? It means its sensitivity is high. And this is the area that a woman experiences that, and through that she can be able to chat. And even with this, it gives it provides another added advantage even to the blind. And it is the most reliable form of observation that a woman can use. Somebody might say, oh, I've never experienced. No, because you have not been paying attention. But because now you know you have the knowledge, you can now make a wise decision if you wish to follow, if you wish to abide. And for that, I think for today, I would like to end there. But before even I end there, if you have been using contraceptives and maybe you want to try and to move, because I understand I work in an hospital setup, there are some women that have been using contraceptives, but some, because of their condition, they have been told not to use. Others, too, maybe they have tried different form of contraceptives, but it has not gone well with them, and they want a change. This is the time, this is the moment that you can try. Remember, its effectiveness is 99%. As long as the guidelines are being followed and there's a cooperation and total commitment. It also requires some subsequent abstinence, periodic, but is not forever. Have you had somebody dying because of abstinence? No, but even that abstinence is only few days. But for the first time, if you are starting the journey of Billings Ovulation method, you will have to struggle at first. You will have to fast for at least 2 weeks, at least 2 weeks, in order to learn and to understand the pattern. Because when you have sex during this period, the seminal fluid might confuse you not to learn your pattern. And here, we are to help you on how to recognize the infertile and fertile phases of your cycle, so that you can tailor it towards your needs, either to achieve, postpone, or monitor your reproductive system. If you have been on contraceptives and you want to switch to artificial family planning, welcome. But now I put a disclaimer. The presentation that I'm giving out, the session that I'm giving out, is for awareness purposes. Kindly do not go and practice solely by what I've just presented. You need to seek a teacher to go through with him or her, and look for certified teachers. Remember also, outside we have quacks who purport to be knowing this particular method, and their techniques is different from the Billings Ovulation method. For me, I am a teacher certified by the WOMS International World Organization of Ovulation Method Billings. Feel free to contact me for my service. I charge, it's like an offer. I am I'm giving it an offer so that many women may be able to be empowered. I charge for the first session 1,000, followed by other subsequent, which can occur maybe once in a month, 500 shillings. That is only to support my YouTube channel and even to support in terms of airtime and bundles, because this knowledge has to reach to all corners, and it is through you and me that will make it. Thank you for listening to me. You can now prepare yourself for other session, which I'll be able to come out with them. The next phases, I will talk about the phases of the menstruation cycle. Today, my video is not clear, but I promise to improve in other subsequent session. This for today was for piloting. Thank you for listening to me. May God bless you. Amen.